Hello everyone, this is Dr. Akif, intervention cardiologist. Today we'll be talking about what is a semi-compliant versus a non-compliant balloon. It is very important for all the medical students who are pursuing DM postgraduates or a DNB course. So wherever they require these basics of difference between a semi-compliant versus a non-compliant balloon. So before going to the main topic, we should know what does compliance means. Compliance means that suppose a balloon is being applied with a more pressure. That means that every balloon normally has some nominal pressure like that. Now what is the nominal pressure? Is the pressure at which the balloon will reach to its normal size. Suppose, for example, suppose a balloon of size 2.5 millimeters, if you apply a pressure up to 11 millimeters mercury or 12 millimeters of mercury, the pressure which is required to reach to its normal size of 2.5 millimeters, that is called as nominal pressure. And now suppose if you are applying more pressure above that nominal pressure, so semi-compliant means the balloon is somewhat compliant. That means if you increase pressure more than its nominal pressure, the size of the balloon will keep increasing. The pressure will remain same, pressure may not be very high, but the size of the balloon will keep increasing in a semi-compliant balloon. Whereas in non-compliant, the name itself suggests that non-compliant balloon, that is, it is not compliant. That means suppose if the nominal pressure is 12, now if you are increasing the pressure to more than 12, that is 14, 16, 18 or so whatsoever, the size of the balloon will remain 2.5. The pressure applied to the wall will keep increasing. That means that when the balloon gets inflated, the pressure to the wall will keep increasing in a non-compliant balloon, whereas in a semi-compliant balloon, the size of the balloon will increase slightly when compared to that. So coming to semi-compliant balloons are made from elastic materials. These are more compliant and usually are made up of Pebax or a soft nylon. It expands slightly with pressure. That means it is semi-compliant, it's not completely compliant. So only slight increase in size will occur, but not very high. It is more flexible and adaptable to vessel shape. So suppose you are using more of tortuous vessels, which are more curvy and all, because it is made up of elastic materials, it can easily pass through those tortuous vessels, and that's why more useful in tortuous or curved anatomy. So commonly used semi-compliant balloons are usually used during pre-dilatation, because when a high pressure is applied in a non-compliant balloon, it can actually dissect the vessel. Semi-compliant balloons are more flexible, more adaptable to the vessel, and they do not dissect much. So for pre-dilatation, semi-compliant balloons are more useful. Also, whenever there is tortuous vessels is there, because it is more elastic, semi-compliant balloons can easily cross that lesion part and all. And also for peripheral intervention and neuro intervention, because the vessels are more tortuous in the brain, for semi-compliant balloons can easily cross the lesions part when compared to a non-compliant balloon. So you can see here, these are the tortuous vessels which you can see. For this type of vessels, obviously a semi-compliant balloon is much better. Non-compliant balloon may not easily pass through this curvosity. So advantages of a semi-compliant balloon, that has a better trackability. It has a gentle expansion. It do not damage the vessel too much. It has slowly expands, and it is less vessel trauma because it is made up of more elastic material. It does not damage the vessel too much, and it is useful for initial sizing and access. So you can see here any artery. First you put balloon, and you can see here a stent. So usually the stent material usually consists of a semi-compliant balloon and not a non-compliant balloon, because stents are usually can expand more to its size. So that's why we use semi-compliant balloons in the size for initially. Post dilatation, obviously non-compliant is better because you want to attach this stent exactly to the wall with more rigidity or with like more adherent to the wall. That's why we use non-compliant balloon, because higher pressure is required so that the stent gets fixed to that. So but initially, when for starting deflation, semi-compliant balloons are used inside the stent. Coming to a non-compliant balloons, these are made up of little bit rigid materials like nylon 12. It maintains the diameter even at high pressure. As I said already, more number of pressure you applied, the size will remain same, but the pressure to the wall keeps increasing, and that helps in tortuous vessels or like that was like mistake. So in this type of vessel, suppose more calcified vessels is there and that type of thing, if you even take a small balloon, but to break that type of calcium or like hard plaques and all, you need a non-compliant balloon, because they can apply the same size, they can apply a more pressure to the wall, can help in the break of those plaques there. So for a difficult plaque or for a calcified plaque or a hard fatty plaque or fibrous plaque, You can use non-compliant balloons are much better because they apply at the same size, they apply more pressure to the wall, but semi-compliant balloons may not be very useful in them. It provides accurate and controlled expansion because it not doesn't increase the size. Suppose you give 3 millimeters of non-compliant balloon, the size will remain 3 millimeters. Only the pressure to the wall keeps increasing. Useful when precise sizing is needed. So when do you use that? Commonly it is used during post dilatation. That is, once you have opened the stent, now you want the stent to be completely adhered to the wall. So for that purpose, you have to use a non-compliant balloon, because suppose it is 3, now you can, wall it looks 3.5, you can take a 3.5 balloon here and you can inflate the 3.5 balloon inside, and so that with high pressure this stent gets adhered to the wall, that is to it gets attached to the wall. So for post dilatation, always a non-compliant balloon is better. Also, it is better for coronary stent optimization. Also using for lesion preparation. As I already discussed, for a difficult lesion, you can always use a non-compliant balloon. So you can see here. So balloon and then stent post dilatation can be always be done with a non-compliant balloon. Initial balloon is always semi-compliant balloon because it helps in easily crossing of the lesion and expanding them without much causing much damage to the vessel wall. Okay, what are the advantages of non-compliant balloon? These are precise expansion control, high burst pressures, like they do not rupture very easily. Semi-compliant balloons have a less burst pressure. What is burst pressure? Is the pressure at which the balloon can get burst. That means it can get perforate or rupture. So there's up to a limit. Like you cannot keep on increasing the size of the balloon. Like keep on increasing the pressure so that there is a particular pressure each balloon can rupture, and that is called as burst pressure. Non-compliant balloon has slightly higher burst pressures, whereas semi-compliant balloons usually have lesser burst pressures. So less risk of over dilatation because the balloon size will remain same, only the pressure is increasing, so it will not over dilate anything, and it is for best for high pressure post dilatation. So stent for post dilatation, always you can use a non-compliant balloon. So what is the rule of thumb is that semi-compliant balloons are more flexible. They are good for pre-dilatation and stent deployment. Non-compliant balloons are more precise. They apply high pressure and these are best for stent post-dilatation. Hope you have liked this video. If you have any more doubts, you can always comment in our comment box, or if you want any other topics to be discussed, feel free to message me so that we can discuss it in our next class. Also, if you need any of the assistance, research assistance, we provide complete assistance to that. Make use of it if required. Thank you. All the very best.